Hi, I'm Dr. Lalit. I'm a consultant neonatologist in Cochin Simar and Mom Premium Hospital. In today's talk, I'm trying to address one of the commonest concerns of expectant parents. By expectant parents, I mean a mother who has undergone regular antenatal checkups, who's free of all complications. She had her scans done at regular intervals, and her scans are all normal. She's sure the baby is absolutely fine. And even for such parents, their next concern is when they're due for delivery. Their main concern is if the baby is going to have any difficulty during birth or after birth, immediately after birth. So, from what others are told, they must be concerned about a baby not crying immediately after birth, or the baby having some abnormality detected immediately after birth, or baby having a breathing difficulty immediately after birth and shifting the baby to an ICU. All these are the common concerns. So I'd like to explain how often do you see these abnormalities or difficulties, and how serious they are, or what can be done for that, or will that have any future implications for the baby. So the first and foremost thing I'd like to say is, as far as you are concerned as parents, avoid all these negative thoughts from your mind. Like if the scans are normal and you had regular checkups done, and if both the mother and baby is fine, just enjoy your pregnancy and wait for the due date. The rest of the things will be taken care by a healthcare professional team who will look after the baby. And still I would like to tell you about all these concerns, because rather than reading it in some internet or social media and getting concerned about it, it's always better to clear your doubts with your consultant, your gynecologist, or a healthcare professional who can help you. So I'd like to throw some light on this topic. The first thing which I explained was baby not crying right immediately after birth. So how often do you see that? The thing is, actually in 90 to 96% of the deliveries, babies do cry on their own. We don't have to provide any assistance. They just cry, they take their breath, they become pink. All we do is just warm the baby, give some clean up, and then show you the baby. That's what is happening with 90 to 96% of the babies. The rest of the 4 to 10% of the babies might require some assistance for breathing or crying. By which it doesn't mean that they need aggressive intervention. It might mostly, in most cases, like 99% of the cases, it's just minimal intervention. We might rub the baby's back. We might give a minimal suction in the nose and mouth, or we might provide some oxygen. This is what happens with 99.9% of the babies. The rest of the 0.1% or 0.3% of the babies might require an aggressive intervention. Even in such babies, we might have some clues right before delivery, like the mother might feel that baby is not moving. There might be some bleeding, or there's something called meconium stain. Like all these are the risk factors which can contribute to such bad respiratory issues at birth. So in all such cases, what you can do is you should have an access to a hospital nearby. Like I know you'll be visiting regularly with a consultant gynecologist and a hospital. If that is quite far from your place, always make sure you have a plan B. You have an access to a hospital which is nearby in case of an emergency. Because if you feel you're not detecting a baby's movement for the past few minutes or hours, it's better to visit a hospital immediately. Or if you have a bleeding right before delivery, it's always better to reach a hospital on an emergency basis rather than taking time and reaching an hospital which is far away. So make sure you have an access in the first place. And after that, if the baby is delivered at a center where you have a proper backup, where you have a person who's trained in receiving the baby and resuscitating the baby, be it a doctor, a staff nurse, or a midwife, in that case also you're in safe hands. Even if the babies have a severe respiratory issue at birth, it will be taken care of. So as I said, the possibility is around 0.1 to 0.3%. So even if that happens, if the baby doesn't cry immediately, and if it's a real bad respiratory problem, if you're able to manage it in time, and if the baby has been resuscitated within the first 1 minute of life, which is called the golden minute, the babies will be absolutely fine. So that is one of the main concerns. The other concern is probably many of them will be concerned about minor injuries which might happen during the process of delivery. So minor injuries are prone to happen, like skin abrasions, minor swellings over the face, lips, head. All these are very common during delivery, especially during normal delivery. But rare cases, we do see some severe injuries like clavicle fracture, shoulder bone fractures, especially when the babies are a bit big, like more than 3.5 kgs, and it's a normal delivery. There are chances the shoulder gets stuck there and in the process might contribute to some form of injury. That's not really rare. So in many cases what happens is there will be minimal swelling and pain which will really go off probably in the next few days. But occasionally we do see fractures, especially fractures of the clavicle bone or the shoulder bone, and occasionally there might be some injury to the nerves supplying the hand. In such cases, in majority of the cases, if it's just a normal fracture, you don't have to absolutely do anything. It will just heal off, and newborns, the healing is really fast. But if there is a nerve injury or swelling around the nerve or something, in most of the cases, like 70% of the cases, all you have to do is some physiotherapy, and it will be baby will recover well in the next few weeks. But very rarely, like in 30% of cases, there might be severe nerve injury. In such cases, you might have to undergo a surgery. So that's regarding the complications at birth. Then one of the commonest questions is, will there be any anomalies which are missed out in the scans and later detected after delivery? So as you all know, the antenatal scans are not a totally foolproof system. You can miss things, but generally if you've done your scans regularly, including the anomaly scan and subsequent scans, and you're done from a good center, the chances of missing out a major anomaly or very common anomaly is very less. And nowadays with the advance in science, I think it's coming down. Previously, over the past few decades, we have significantly improved in antenatal scanning technology. So it's actually coming down, but still you will have a very rare chance of missing out things which can happen. And the next common thing which you hear is breathing difficulty after birth, or breathing difficulty which is seen in a term baby without any other complications. So how often do you see that? But I should say it's not very uncommon, especially for babies who are born at around borderline term age, like 37 weeks, babies who are born to mothers with cesarean section, or babies born to mother with diabetes, and all those cases you can see respiratory distress, which is very common. But the thing is, just because the baby is breathing a bit fast, it doesn't mean it's a real respiratory problem. Many a time it can be something called as transient tachypnea. Transient tachypnea, as the name indicates, it just says the baby is breathing a bit fast, and it's actually transient. It just disappears within the next few hours, 2 or 3 hours. So what happens is, as you all know, when the baby is inside the mother's womb, the lungs are filled with the fluid. And once they come out, they take the first breath and the fluid just clears off. So in some babies, especially when those group I mentioned earlier, the fluid clearance might take some time. So during those few hours, the baby might breathe a bit faster. But if the baby's oxygen requirement is not there, baby is otherwise pink and active, I don't think you have to be worried at all. In many cases, what happens is the baby will require an observation in the NICU for a few hours. We might take an X-ray, we make sure there's nothing wrong with the lungs, and if the baby is otherwise fine, we'll just leave it. Over the next 2 to 3 hours, babies usually settle down. All we have to do is we have to observe the baby in an ICU, and probably we won't direct feed the baby or breastfeed the baby at that point, because as you know, the baby is breathing fast. We don't want to we aggravate it. So all we do is just observe, make sure it settles down. Till that point, we might feed the baby through a tube, and once it settles down, we'll go for direct breastfeeding. So transient tachypnea is also something which can happen, and can happen in any baby who's born term without any complications as well. So these are some of the common rare complications we see in otherwise normal pregnancy with a normally grown baby without any antenatal issues. So as I told you before, the first and foremost thing is don't bother about such, don't be concerned about such rare complications and get concerned about it. If you have any doubts, just talk to your gynecologist and try and remain calm and enjoy your pregnancy. Thank you.